I don't think you should be trying mouth taping as a first port of call if you have severe nasal issues or sleep apnea. Really, that can kill you.
Today we're joined by Dr. Karan Rajan, NHS surgeon and medical educator, helping people understand their health with clear, practical and evidence-based guidance.
What are the best forms of fiber for optimizing gut health? How can listeners make sure that they're getting enough of the right kind each day?
Rather than thinking about specific kind of fiber, you just need diversity of fibers. That's the sort of final solution.
What's one popular health trend you believe is most harmful?
There was this popular trend where people were it just seems bizarre, and I think that's pretty harmful as a trend. Yeah.
What's your advice to supporting the gut and immune system during and after using antibiotics?
So I think...
Dr. Karan, thank you for coming in. This is going to be fun.
No, I'm excited to be here.
So you're an NHS surgeon with a strong academic background. What inspired you to step outside of the traditional medical space and start educating people on platforms like TikTok and Instagram?
I've been on social media in some way or the other for the best part of 14 years. So even whilst I was in medical school, I was creating videos in the bad old days of YouTube before it was cool. And I just wanted to provide some video education because I felt that was a gap that wasn't being met at the time. And now everyone's doing it.
All right, cool. I mean, that's pretty, I didn't realize it was that far back, to be honest. So it's been going on a while, because one thing I think, obviously, I hate saying this word, but being a creator myself, is it's actually really hard to do the type of content that you do. I mean, I have a big team. They tell me to do all these different angles and like all this content, and I can't ever seem to get to do the stuff that you do. So obviously it's a long experience, a lot of experience that's gone into it to lead to this, and everything you share seems to be bloody sticky, and everything seems to do so well. I'm looking at my statistics and going, I've only reached like 5,000 people with this one. There you are with 25, 35, 40,000 likes on them. And I'm just like, it's just, you've got such a cheeky, cocky lad like way of doing it. And the angles are so good. So yeah, awesome.
I mean, listen, I've been making video content since 2011. So the best part of 14 years. And I'm still learning on how to optimize. And it's not optimizing so I get more views. It's optimizing so I can make the information, as you said, as sticky as possible, because I want people to understand what I'm saying. So if you look at my videos from 2011 to now, it's day and night. Even before 2011, I've always been interested in video, acting, drama, that sort of stuff. So all of this is channeling all those communication styles and the excitement and entertainment. Because when you watch something, and science can be very boring and laborious to take on board, you need to find a way to make it fun.
It's funny because you're obviously a very qualified guy and a lot of, as I say, academic background behind you and real world practice within the NHS. And yeah, it's easy to label someone as just an influencer. And I hate that because like so many people say, oh, what do you do? And I go, I'm an influencer. And I'm like, I feel like actually there's a lot of business background and psychology behind me, but it's like, it's easy to label someone as just an influencer. You know what I mean? And it's...
Yeah, I don't like the term myself either because I don't want to influence anyone. I just want to educate someone, give someone a piece of knowledge, and then it's up to you what you want to do with that knowledge.
That's a really nice reframe. I don't want to influence anyone. I mean, the reality is obviously we influence everyone all day, every day, and our social circle influences us with micro things. But I do like taking that away from the influence and saying, educator. I think that's really nice. And I think one thing before I move on to my next question is that the rise of Instagram and TikTok is like everyone's not got a lot of concentration and they're easily distracted. So a 30-second reel becomes a mini magazine, like something, or a mini TV show that just captures your attention with music and movement and the visual hooks and all these things. And so being someone with such a science and medical background, being able to do that as well, it's actually quite unique because most people don't have any qualifications, myself included in that, I mean, except for psychology. But yeah, awesome. So it's really cool. So it's a long time you've been doing it then. So it makes a lot of sense. One of the OGs.
Yeah, it's fun. It's been an interesting journey to see how the social media landscape has evolved over the years and novel platforms like a TikTok, Instagram Reels, how they pave the landscape as well. Because I was making YouTube videos that were 10, 15, 20 minutes long, and you really have to buy into those and you have to self-select to watch those sort of things. Nowadays, as you said, people having shorter attention spans, 30-second videos, you have to know your material and your information so much better to be able to distill information in that short time frame. So I take it as a challenge. Do I know this bit about the microbiome well enough to give that information in 30 seconds? Because you really have to, know your own content to do that.
They say if you can't explain it to a 5-year-old, you don't understand it yourself.
Exactly.
And I love this saying because it's like there's so many smart people, that really, really know their stuff, but they can't explain it easily. It's great to be able to distill it down to that. However, it does come with a danger as well at the same time. In fact, because the other week, a friend of mine said to me, "Oh yeah, I love this post on Instagram," and it was one quote, something to do with psychology. I was like, but there's so many nuances in that
Hmm.
that this person clearly doesn't understand what they're saying because they've belittled this whole massive great topic down into this one little quote that shows that they don't understand it, because you can read this one way or the other. And in fact, there are, I guess it's like saying, take this supplement because it's great for this, but without telling you a major side effect, and it's like they don't understand the side effect. So I think that's one of the extra assurances with having the medical qualifications behind you, is in like, well, actually, you generally do know a lot more about this topic than people that are just putting out one quote.
Yeah, I mean, my sort of caveat to that as well would be there's a great deal of authority bias placed on the shoulders of people who have a degree, whether it's a medical degree or a nutritional degree, whatever it is. Yes, that degree means that you've put in the work and you've got this baseline level of understanding. But just being a doctor doesn't mean you're an expert in something or that you're right all the time. And I'll put myself in the ring here and say I've revisited points of views I've had on certain topics and themes before and changed my opinion on them, because that's the demands of science. Science changes on a weekly basis sometimes. Knowledge can be out of date as soon as you finish medical school. So you have to keep revisiting the knowledge and be open to being flexible. And so the point would be that, yes, if I was looking for a piece of information, I would look for someone qualified to talk about that first and foremost, but that doesn't discount someone who's not an expert in that talking about it, as long as they can back it up with facts.
Why do we go to a doctor or a medical professional? It's because the chances of them knowing how to help us is greater. Therefore, it's a heuristic. And everyone around us, if you need, your shoes fixed, you go to a cobbler. If you need your hair cut, you try to avoid your mum and hopefully go to a barber. But it's a heuristic. It's like, this person knows this better than me, so therefore my chance of winning is greater in whatever that may be. And I think it's the same with investment. The old adage of, you wouldn't ask a homeless person for investing information. It's just, so I think that's a heuristic. But yeah, you're right. It's the best chance of being correct going to someone with the qualifications, because they're most likely to know the most detail about it, right?
Yeah, and it's also dependent on what type of knowledge or skill you're seeking. So, for example, if it's about legal advice, there may be someone who's not a lawyer who's had real world experience of that and can tell you maybe better than another lawyer who's not an expert in that. However, if you want your bowel cancer removed, you're not going to go to someone who's has great knowledge about bowel cancer, but has never done an operation before.
Yeah.
You need to go to the one who's done 100 operations before.
So the answer is common sense. Basically, it's common sense.
Use
it's
your
like,
common sense.
Yeah. And I think this is for instance, in the way that I've positioned this, it sounds like you shouldn't listen to me because I don't know, I don't have the qualifications. However, I think, I like to interview and invite speakers that are experts, and I learn from them. I don't just learn from an influencer with no background. I do listen sometimes. For instance, I might hear, one of the big podcasters that have no qualifications mention something, and I'll dig in down the rabbit hole and then find a specialist in that area. And I think this is typically the way it's going. So it's actually really interesting. So what's the what would you say is the biggest learning out of everything from being on social media over the last, 13, 14 years? What would you say the biggest thing of all?
Um, it depends which angle you're looking at it for. If you're looking at it from the lens of someone who wants to be on social media and create some sort of empire or some sort of standing on that social front, then you just have to show up and be consistent and, build it like you're building a startup almost. If you are on social media to learn, then I think you need to look for nuance in everything, because if you're following people who give hyperbolic statements and a lot of, are very polarized and binary in their thinking, that again misses the real world nuance. So it depends which side you're coming at it from, the creator or the someone who wants to receive education. And I think most of us are a bit of both.
It's interesting. There's a few names that popped into mind when you said that, polarizing on both sides.
Yeah.
It's funny. I mean, half of them have been blocked. I block them these days.
Yeah.
So there's there's often tension between mainstream medicine and online wellness culture, as we're all very familiar with these days. But where do you see yourself fitting into that spectrum? And what type of gap do you think you're trying to fill?
Yeah. And this is probably something related to what I alluded to just a couple of minutes ago. There are traditionalists in medicine who purely stick to the guidelines, and we have guidelines in place to keep people safe. They're based on evidence. Sometimes that evidence may be a bit old and needs to be updated. And then there are these sort of pioneers who really are looking for that new frontiers. And that's not to say it's without evidence. Sometimes it's N equals one, anecdotal evidence, and that may or may not work for everyone, but it's interesting science. And then there's a gap in the middle where you have to blend this traditional medical advice and science, but also look futuristically at novel science and be open to it and not be a total skeptic. I mean, you can be a skeptic with, the sort of an open mind. How can that fit into certain things, and how can that fit into personalized medicine? So where I'm trying to be is I'm grounded in this sort of scientific empirical evidence, but I want to be open to new things and test them on myself, look at the evidence and be open to things and have conversations, because everyone wants to improve their health. Everyone is looking for something new, something extra. And I'm also open to it as long as I can see that there's some evidence behind it and looking at the benefit risk profile. So that all of that culminates, the common denominator of all that is, again, education. I love educating people, but also love educating myself. So the new way of me trying to educate people is through educating myself and sharing that knowledge to others.
Yeah, it's a great way of putting it. And thank you for sharing. So, the global biohacking market is projected to reach 63 billion by 2028, reflecting growing public interest in personalized and health optimization medicine. So the people have spoken, right? It's clearly not going away. Having said that, my audience leans towards total optimization. So what do you say to those who feel mainstream medicine dismisses innovation too quickly?
Yeah, I agree. I think there is this culture of dismissing things which doesn't fit with the traditional model of medicine. But I think again, it's what I'm trying to do, and I think a lot of other people are trying to do as well, is blend the old with the new. And new doesn't mean useless and without evidence or without any sort of basis in science. And old doesn't mean bad and outdated, because that's also built on decades of evidence and real world evidence. So, yeah, I don't think we should be dismissive of that. And we should look at it as a case by case analysis. Something novel and that in that sort of biohacking world may be very effective for you, and you found it effective and it's got a very low risk side effect profile. Should you continue doing that if that makes you feel good and we can quantify how that makes you feel good in terms of your physiological parameters? Yeah, why not? If you can afford it as well, it makes sense. But again, it's that case by case basis. And traditional medicine doesn't have the bandwidth to do that personalization on a case by case
Mhm.
basis.
Yeah, it's actually. Again, you raise a really, really great point. It's like the amount of treatments and things that I've done. I'm like, is this actually, going to be effective in any way? Or am I just putting my body through another treatment? There's like no real, you know, for instance, if I'm knackered and I'm jet lagged, um, and I have some IV, whatever it may be, or if I've got a migraine or
Mm.
whatever, and I have an IV and I'm like, wow, I felt that. And I think the problem is when you've got a headache, a painkiller or whatever, works, or if you take psychedelics or whatever, it works. Whereas when it's preventative, you don't know if it's ever working. I mean, you long-term view, you can't snap your eyes and see 30 years ahead. Is some of this stuff actually working? And I think if I think back to the NHS model or, typical medicine, and it's like if every doctor or specialist took on the viewpoint that everything worked all the time and they updated the curriculum, they would be implementing stuff that haven't been tested by time. And I think it's quite a risky move. And I think, to talk about, for instance, medical licenses and things like that, I understand there's a few things that can be incorporated, low risk, like red light therapy or, hyperbaric oxygen
Yeah.
therapy now, which is, proving to be pretty good in a lot of treatments. But if they're involving, oh, let's do peptides, let's just do this, or let's just do that, it's like, it's a minefield. And, it only takes one to go wrong and then it's shut down for the rest of us. So I think
Yeah.
it's a very interesting point. And I think for me, I can talk about most things because I don't have a license to lose and I can explore whatever I want in whatever country it may be legal in. I think for a medical professional, it's very different. And so in a way, it's freedom for me, but it could also be riskier in doing some of these things.
Yeah, I agree. And one of the things I would say also to add to that point that you made would be we've already come across and we know we've invented most of the major buckets that are going to have the biggest impacts on our health. We already know the biggest levers. There's nothing new in terms of what we know about the human body that's going to be another mind-blowing lever unless, we go into gene therapy and stuff like that. But that's not available to the common person. I'm talking about the big buckets like nutrition, sleep, movement, connection, sunlight, all of those things we've known about for decades. And they're not sexy and they work. And even novel gadgets, and I've got them as well, the Aura Ring, that's just an add-on to the bucket of sleep. The Aura Ring only helps you have accountability over your sleep. You don't need an Aura Ring to have better sleep. In fact, when I first bought it, I was checking the app every single day to check it. I've not checked the app in over a week now. So do I actually need it anymore? I feel great when I wake up in the morning, go to bed around 10:30 every night. So I might get rid of it. I don't need it. It's a, short-term duration usage. And that's the thing, right? There are these new things, NAD, red light therapy, all these things, and they may work for that extra 1%, 0.1%. But I think most people would benefit doing all the other stuff first.
I love that you've just said that. And I'll tell you why. This morning I spoke at the Founders Forum longevity thing, which we mentioned over our juicy steak. And I was standing in front of a load of biotech people, a load of investors, family office, people, some health people, too. And I gave a talk on where the longevity space has got it all wrong. And I had a pie chart, which thank you, ChatGPT. I typed in, I want a pie chart, 80-20, 80% saying fundamentals of health with an arrow pointing at the 20% saying where you're focusing. And that's the longevity. And I think it's funny because I asked them, I said, who here last night slept well? And had like out of 150, 200 people, had 4 or 5 people put their hands up. And then I said, okay, who's hydrated properly today? Same again. Like, went through a few of these fundamentals, eating well, sleeping well, hydrating well. I said, oh, who hasn't cheated this week badly with their food? It's like 2 hands. It's like you're at, so the point is, and I've done this at several places similarly as well. And it's like, they're focusing on the NAD. They're like, yeah, I want this amazing molecule injected into me, which is going to cost me £400 or £500. But yeah, no, I haven't got enough time for sleep. So I love that you said that because it's like, it just seems like bonkers.
It was eye-opening for me in how such seemingly small things can have such a big impact. And I remember 2020, I was listening to Matthew Walker's Why We Sleep audiobook. And I didn't realize up until that point how bad my sleep was with the shift patterns I was having at work, night shifts, on-call shifts going 14, 15 hours, just not getting enough rest, scrolling, on social media before I go to bed, waking up at odd times, waking up, checking my phone first thing in the morning. And I addressed all these things after reading that book, and I felt a lot better. And also around the same time, maybe a couple of years before, focusing more on my gut health as well, just eating more fiber consistently. And those two things, just independent of other things like exercise or whatever, have huge impacts on your health. And for me, you don't need supplements or anything. I mean, I take supplements. I take multivitamin. I take omega-3. I take all those things. But, all of those things can be mitigated by optimizing those big lifestyle factors first.
Yeah, I mean, perfect segue into the next question. And I'm sure Brock, who's our producer, is smiling at this because the next question is, you've posted about the dangers of over-supplementation. Can you give me some examples of which supplements are safe and which ones you think are dangerous? So I love that you just touched on that.
Yeah, I think probably blanket statements are usually not very useful when it comes to supplements. It's, again, a case-by-case scenario. The issue with supplements, as a lot of people know, is that there's very little regulation of the industry in general. When it comes to marketing them, certain health claims that can be made. Many supplement manufacturers could hide behind proprietary blends, so you may not know what exactly is in them. Are they clinically dosed? Are they even effective at the dose they're claiming to be? Most supplement brands don't have trial data behind their blend. It's based on referencing data out there already. So there's lots of inherent issues potentially you can point fingers at with the supplement industry. For me, if I was just giving advice to someone about supplements, I would obviously say, start with your diet first and then see, do you need any gaps filled in? And for specific physiological stages in someone's life, they also may need supplements. For example, have they got iron deficiency anemia because of something? You've ruled out other medical causes. Okay, need a supplement potentially. You're planning to get pregnant. You are pregnant, postnatal. There's a certain, formulation which will be essential for the baby's spinal cord development. B12, things like that. But beyond that, advice I would give if I was telling someone about supplements would be around the liver mainly, because a lot of these supplements, when they're ingested orally, and a lot of them are ingested orally, they have to go through liver metabolism. They're broken down by the liver. There are certain things at high doses which can directly impact the liver and cause liver injury, liver fibrosis, and scarring of the liver, which no one wants. Some of those things like black cohosh, high dose green tea extract, red yeast extract, all those. There's like, if you go on Liver Tox, which is like a database of various supplements and drugs, and you can actually look, they're graded A to E, depending on how risky they could be, depending on a certain dose. So that's the number one advice. Look out for specific supplements, and in high doses, can they impact your liver? But also treat supplements as medication. If you're on medication already, other medications could interact with them. So an example would be, if you're on a blood thinner, like warfarin or anything like that, grapefruit can interact and affect the side effect profile of the warfarin you're taking and make the warfarin less effective and decrease the coagulability of your blood and make you at a higher risk of bleeding. So there's also other certain medications which can either decrease or increase enzyme cytochrome P450, and that can also affect the medication you're taking. So look out for those drug-drug interactions. And if you're dosing multiple different supplements, there may be overlap in some of the active ingredients in each one. So you may be mega dosing. And in certain cases, for fat-soluble vitamins like a vitamin D, if you're significantly overdosing vitamin D for a long period of time, that could cause some side effects as well. So be very conscientious that you're not doubling up across different regimes.
Yeah, it's a good point. I mean, it's funny, whenever I see a biohacker fill their mouth with 50 or 60 supplements and boast how many supplements they're taking every day, I actually, and there's some pro ones that do it, I
Mm-hmm.
actually think you're a novice. I mean, someone may take offense to that, but the point is supplements are to supplement. They are to tweak and help optimize our health, or, for our bodies to operate as they should, not
Hmm.
necessarily overclock. Because I think whenever you overclock the body, and, typically you can think about, uh, amphetamines or MDMA or something, and you overclock the body in some way, it always has a refractionation period where it's under and it has to recalibrate. So I think, you can't overclock the body really. And I think what biohacking should be is to get it back to the main operating baseline, not try to improve it. And I think these people that are sticking in 50, 60, 70 supplements a day are trying to overclock it, and they just don't get it. Or they're doing it for the show factor. And, and I'm not pointing fingers specifically or being too judgmental, but I do think it's the wrong approach to project out into the world. Because, now I take 5 supplements a day, and,
Hmm.
I rotate them or change them depending on what I need. And in fact, I do know people that are into kinesiology, for instance, that actually muscle test their supplement on a daily basis. And if their body doesn't feel like it needs it, they won't take it.
Yeah.
And I've become more intuitive with it. It's like, oh, do I want my triple B12 today? No, I don't feel like I need it today. Or do I want an extra dose of creatine? Yeah, I do. Uh, And I find that that works very well. But yeah, you're right. The compounding effect of all these things is like, it is okay, everything's a chemical. Hate that line, but everything is. And, you can overstress the body. And I think I'd love to touch on the liver thing quickly before we move on, because it is processing everything all day, every day. And in the thousands of times more chemicals every day than it ever has done in history, like hairsprays, face creams, just whatever. And I think when people have their gut issues and can't tolerate some of these foods, or can't even tolerate fiber very well or whatnot, it's often down to the liver being stressed and not being able to do its own thing. So I'd question, how many supplements are they doing before they get to that point?
Yeah, true. And I think someone who is taking 50 odd supplements should look at their life again, their sort of lifestyle factors, and do they need each one, and rationalize those things. And I'm always a little bit hesitant to list what supplements I take, because I don't want to, again, influence anyone into saying, I need that as well.
Mm,
But if I do list them, I always like to give a reason for that thing. So, for example, a couple of months ago, I found out that I was vitamin D deficient on a routine blood test I was doing, and I did my own self experimentation where I mega dosed vitamin D, 12 days, 20,000 units a day for that period of time. Then I dropped to a maintenance dose. So right now I take 4,000 IU of vitamin D daily,
mm,
and that is with a vitamin K as well, vitamin K2,
mm,
and I have that with a source of fat. I also take omega 3. I take a vegan algal oil, just because the taste wise, I don't like the sort of fishy taste of the normal fishy omega 3. And the algal oil omega 3 is as
mm,
effective in studies. I don't eat enough fish on a weekly basis, fatty fish. So this
mm,
is why I take it. If I was eating salmon every week, I probably wouldn't, but I just make sure that it's got a good amount of DHA and EPA. I also take prebiotic fiber supplements and psyllium husk every single day.
mm.
And I used to take a daily multivitamin as well when my schedule was hectic and my diet was poor, but that's not currently part of my regime.
Yeah, solid stack. And I just,
And creatine as well.
yeah, I know. We definitely bonded over the creatine thing. I love this. Yeah, no, I think it's nice to hear what you're taking. I mean, it's minimal and it's good. I mean,
Yeah.
clearly looking at you, you seem very healthy. Your skin's very good. Your hair's great, and I mean, it's you seem more optimized than the average, and yet doing 5 or 6 supplements a day too, which I really value, actually. And I mean, there is the test case for, why do humans have sex, for instance? Well, it's to reproduce and it's for fun. There are 2 elements to a lot of things that, we really enjoy in life. Why do I buy a hack? I do it for health first. I also do it for fun. So it doesn't necessarily
Yeah.
have to have an immediate payoff other than I enjoy this stuff. So there are sometimes things like, I tried the whole resveratrol thing once upon a time, and I take a few interesting things that I'm hoping work for longevity long term, like urolithin A, I quite like. But generally, the routine ones are supporting my liver, such as Swedish bitters. I love these, and my digestion works so much better with them. phospholipids, PC. Actually, I use the Body Bio one, have done since 2016 before I was known as Tim Biohacker. And sometimes butyrate, but that smells like baby's puke. And I tried to avoid it as much as possible, but sometimes it really does help. Um, but yeah, generally most of is around liver or digestion, funny enough, which is, obviously part of the reason why
Mm.
I have an affinity to your content and the things that you talk about, because I think it's most underrated, one of the most underrated areas to optimize.
I agree. And also on that point of you find it fun, I also find it fun. And I'm open to trying new things just from a academic point of view sometimes. For example, I have certain thoughts, nuanced thoughts on probiotics.
Mm.
And I'm also interested in something we discussed earlier, which is the oral microbiome. And I use an electric toothbrush. I'm brushing twice a day. I floss. I do all the good things when it comes to oral health. But I'm wondering, is there something more I can do? I'm interested. So I take these chewable lozenges that contain Lactobacillus reuteri and a certain strain ID within these chewables. And it also has xylitol. And I suspect it's the xylitol doing the heavy lifting, not the probiotic, because probiotics supplements in the mouth. I don't know how much evidence there is, and I really want to lean on evidence. I've just been taking that once a day just as it's like a mint essentially. So worst case scenario, my breath smells minty fresh and, the bacteria and the xylitol, do nothing. Although the xylitol is doing something.
Mm.
It's actually killing bad bacteria in the mouth. Streptococcus mutans most likely. So yeah, that's another experiment I'm trying, and it's fun. And it's a low cost experiment, and it's not going to harm me taking some probiotic lozenge mints.
Yeah, I mean, risk to reward. I mean, there's like, for instance, an oral probiotic I take is from Super Teeth, and I have their toothpaste, which is the prebiotic, and then you have the probiotic
Oh,
afterwards.
cool.
So it actually works very well. But so it's very low risk and quite high reward potentially high. I mean, there was obviously I went to Sarasota to see Dr. John Lawrence in a longevity clinic about a year ago now, and had prostate injections via the bladder with a big needle with methylene blue, ozone, and antibiotics
Wow.
to help with prostatitis, which I had done twice. I had the painkiller of ketamine, so I saw the divine and left the planet and didn't even realize what was going on. But
Yeah.
the point is the risk was actually, it's pretty high with that type of thing, I would say, compared to taking a supplement. But the reward from, 10 years of prostatitis that I'm just told I have to live with, it nailed it within 2 sessions. And so, the risk is high, the reward is high. And
Yeah.
so the general public don't necessarily need to do that, but it can be fun. Although when I was on the table off the planet, I was thinking, Tim, have you done it a bit? Have you gone a bit far this time, mate?
Yeah.
I was like,
Exactly. That's again the case by case thing. For you, in that particular scenario, prostatitis can be horrible. So in that scenario, the risk reward ratio, you went down that decision. But someone who didn't have prostatitis and wanted to do some optimization in evolving that invasive therapy,
Mm.
it clearly doesn't make sense.
Yeah. Yeah, I agree. I mean, it's a risk to reward. And I mean, if you don't need the reward, why take the risk? Right?
Exactly.
So let's move on to something else. How about this? Let's talk about something extreme, like the trend of mouth taping while sleeping. Now, you called it unnecessary in one of your videos. What's the science behind your take? And is there any nuance that gets missed in this short form content? Tell us more.
Yeah, so there's a lot of nuance missed in short form content. And I can't remember exactly when I did that video, but, as I said before, I'm always open to updating my stance based on doing deeper dives and looking into it. And since I think maybe that video must have been years ago, maybe 2, 3, 4 years ago. And recently in my newsletter, I posted a segment on mouth taping where I was a bit more nuanced and I gave, again, the sort of use scenarios, try if this and don't try if this. And this is probably where I'm going to land now. And I think if it's going to improve your sleep or it is improving your sleep, it's cheap, it's low cost, with again a low side effect profile. I don't think you should be trying mouth taping as a first port of call if you have severe nasal issues or sleep apnea. You need to, because that can kill you. you should see a sleep physiologist, you should see an ENT surgeon, you should see a doctor to get that sorted and find the underlying cause. However, if you have no issues with nasal breathing, you don't have a deviated septum, you're completely fine with nasal breathing, and otherwise in okay health, maybe you have some snoring issues or something like that, yeah, you could try mouth taping and see if that has any benefits. If you are mouth taping, you should make sure that you use good quality tape. So 3M tape, not shitty, Elastoplast or some sellotape, basically. You need to use the good quality stuff.
Sellotape.
And
I get the Christmas wrapping paper to tape out.
yeah.
You have Santa Claus across the mouth.
And the other two important caveats with mouth taping is that you should first try it whilst you're awake, so you don't panic at night. And number two, you should also track something as well. So you're actually objectively seeing things. It's not just a subjective, oh, I'm feeling better. That's also great, but objectively track it. What are your SATs doing when you're sleeping with mouth taping? Are they better than they were without? Are you snoring? If you sleep with a partner, are you now snoring versus not snoring with the tape? And actually track your sleep metrics, whether it's just a diary, or an Oura ring, a Whoop, whatever it is. Can you quantifiably measure that your sleep is better with this? What I would say is that, again, it's good to just have an understanding of your own body. And if you want to try that, great. I will also just finally say that the data is not convincing in the published literature when it comes to mouth taping. Most of the studies are small scale, limited long-term follow-up, don't have enough participants, but that doesn't mean it's useless. So that's my updated stance. I don't think it's useless, and I think a lot of my friends have benefited from it. But again, you need to make sure that you're not harming yourself.
Yeah, no, great advice. I mean, I like the nuances on social media, but people don't say, well, don't do it if X, Y, and Z is what it feels like. I mean, I started doing it back in 2019, I think it was. And for the first 3 nights, I ripped it off in the middle of the night thinking I was being kidnapped or something or other. And it was a bit weird. But after that, I got used to it, actually. And yeah, as I may have mentioned earlier on, I used to trampoline in the back garden. And when I first started, I couldn't even trampoline without mouth breathing. And then after learning to sleep, mouth taping, and I needed it for 3 or 4 weeks, and then I didn't need it anymore because I kind of sleep with my mouth closed automatically. But found that my trampolining, I could trampoline for ages without mouth breathing anymore because I practiced to be more measured through my nose.
Remember, if you want to learn how to take control of your health and you're sick of traditional healthcare and temporary fixes, you should come to the Health Optimization Summit. You can join other like-minded enthusiasts and meet the world's leading minds in health, wellness, and science. You can even test out a load of groundbreaking health tech and latest supplements. Get your tickets at healthoptimization.com.
In Patrick McGowan's work, he talked about the Butico method, oxygen advantage practitioners around the world. Is actually his work, because I've tried loads of different breath work, don't get me wrong. And I think, more breathing, or should I say better breathing, better movement, and all these things, fantastic for any human, I think is great. When I learned about oxygen advantage from Patrick specifically, is in most of us are shallow breathing too fast. So therefore, we're over-oxygenated and we're breathing too much, but we're under-oxygenated because obviously we need carbon dioxide to force oxygen into the cell. And if you can't hold your breath for very long, you can't hold the carbon dioxide properly and therefore under-oxygenated. That's the principles of it. I found that from nose breathing, I'm more measured with my breathing and my breath rate came down. So I was breathing slower and more calmly, which has calmed my nervous system for sleeping. But then that taught me to deal with carbon dioxide better naturally, which meant I'm oxygenated better. And then when I did my VO2 max test at the Ohio clinic in Chennai, I ran for 15 minutes flat out through my breathing through my nose. And I was running on this machine going as flat out as you could when you think I just,
15 minutes.
15 minutes. So you start slow and you build up until your maximum output. And I was laughing at my head, although my body felt like, I can't believe I'm pushing myself like this. In my head, I was laughing at myself and I was like, dude, you're sprinting as fast as you can sprint right now, which is 1, feels great. But 2, it's through my nose. I couldn't believe it. And I was like, wow. So my underwater swimming has become better. So I do think there's nuances within it, but I do think it's interesting. No, I'm happy you revisited it somewhat because obviously it's anecdotal, it's individualized for me. Um, so yeah, so I'm glad we align more on that, and I got to say I really appreciate when someone has a view on something, learns more about it, and then changes their view on it because that shows integrity, which makes me trust the rest of the work even more.
Yeah, and I think you have to be open to do that, as we said earlier. Be open to evolving science and just generally putting your hands up and saying, "Hey, this is my updated stance on it." And just to add to the mouth taping thing, something if you didn't want to do mouth taping for whatever reason, something I've tried when I've had a stuffy nose is just nasal tape.
Mm.
And when I've been sleeping, nasal tape has been really effective.
Is that,
Again,
is that one of the ones that opens up your nose a
yeah,
bit?
it just sort of opens up so you get a more airflow. Again, this is something that doesn't have a lot of data, but it just makes you feel better. And you can't argue with that n equals one. It just makes me feel better. It's literally a sticker on my nose. It's not going to cause any harm to me. And I actually feel perceptually I'm breathing more oxygen and I feel that I can, breathe more deeply and it puts me to sleep better sometimes when I've got a blocked nose.
I've tried these strips actually, and my mentee, Gaetan, the founder of Mythos, the skincare brand I recently invested in, he wears them when I'm on calls sometimes. And Alex Hormozy wears them.
Yeah.
He's well known for wearing these things. And I've tried them a few times actually, and it does feel like you've got
Yeah.
more breath. However, I have histamine at the H1 and the H2 gene down-regulated, so I don't deal with histamine too well. So often, depending on what I eat, I can get a stuffy nose. I find that if I use this sinus decongestant spray, the medical one, which I don't use too much because it can become very addictive, I find that my sinuses are completely open and I sleep much better. And if I measured my snoring actually with an app, it stops me snoring because my sinuses are open more. It's really super interesting.
Wow.
Yeah. So I've tried hacking it in multiple angles, and the sinus spray works, and the nose strip does as well. But when you use the sinus spray and the nose strips, I mean, it's next level. But you don't want to have your woman in bed with you looking like that. It's especially when you're mouth taping and nose stickers
Oh,
and
God,
face
yeah.
mask and blue blockers before you get into bed. It's not the most attractive look in the world. So anyway, I want to move on to antibiotics specifically, because in 2022, US healthcare providers prescribed approximately 236.4 million outpatient oral antibiotic prescriptions. That means that for every 10 people, there are 7 antibiotic prescriptions filled. Now, I have some real experience with antibiotics, one for previous dental surgery work and from my prostatitis from years ago, which I was on for 3 months, and some use of ciprofloxacin, which is a mitochondrial killer and has a black box warning, and I did not do too well with it. So I have a fair amount of experience from a personal use of this stuff and reversing the damages of it, which I think has taken me a decade to do. But, you know, I mean, I understand that they are essential, because we don't die of infections like we used to. That is fact, right? But we're also living with more allergies, more gut issues.
Yeah.
Like so many different underlying health issues that come from not having enough gut bacteria. So they're misunderstood, I think, and they get a bad rap in the alternative health space, although they have an amazing application. They've definitely saved me for sure. Like when my CRP was 80, 85 or something or other when I had an infection. So, I'm grateful for them. But what's your advice for supporting the gut and immune system during and after using antibiotics?
So I think there's 3 phases when it comes to antibiotics, and sometimes the first phase may not apply to everyone. So if you know you're going to be started on antibiotics, so say you're about to have a procedure and that's planned and it's going to result in you having antibiotics during the procedure and maybe for a time afterwards, you've got an indication that you've got time to prepare your gut to be optimized for antibiotics and then the consequences of that. So there's that pre-antibiotic stage. If you've got the luxury of having that, you can optimize your fiber intake and probiotic intake as well. Now, when I say probiotic intake, I don't mean you need to take probiotic supplements, but just the food you consume. You're trying to increase, and we'll keep coming back to this same point. It's the 3 Ps: prebiotics, probiotics, and polyphenols. And an example of a breakfast I eat quite a few times a week, which has high quantities of all of those, would be Greek yogurt with chia seeds and raspberries mashed into like a sort of jam. And the raspberries, that bright red color, full of anthocyanins. Those are polyphenols, which have an antioxidant effect. The probiotic Greek yogurt and protein as well. And then you've got the prebiotics in the raspberries, but also in the chia seeds, good source of soluble, insoluble prebiotic fibers. And that you can start improving your gut baseline that way. Once you're on antibiotics, you need to make sure that you're only taking it for the duration prescribed. No more, no less. Complete the dose. Don't stop it, before, because that can increase antibiotic resistance and cause more problems for you, and you might need more antibiotics. Don't do that. And, don't prolong it because, again, they're like little mini nuclear bombs for your gut, and just take it for that limited duration. And even whilst you're on antibiotics, you can continue that pre-antibiotic restoration phase during as well. So listen, you can just mitigate the damage that may be caused to your gut. You have to accept it. There is no antibiotic that's going to limit damage. You just have to try and do it yourself. Post-antibiotics, depending on your symptoms, if you're having a lot of diarrhea post-antibiotics, there may be a role for probiotic supplementation if it's clinically indicated. And you need to ask your doctor if there's a specific probiotic that you can take, something like Saccharomyces boulardii or a specific other type of strain that can help with post-antibiotic diarrhea. And also continuing the prebiotics, probiotics, polyphenols in the after stage. Your gut microbiome will be in flux for several weeks to months after a single course of antibiotics. It's not just a case of, hey, I'm recovering after that, I need to sort myself out for a week. No, you need to sort yourself out for weeks and weeks and weeks. And in some cases, potentially months. So you really do need to do a repair job on your own conscientiously. And there's 3 distinct phases I'd like to think of when it comes to antibiotics.
Thank you for that. That's amazing. I mean, I was actually found to have a certain bacteria. It will come to me the name in a minute, in my tonsils a few years ago. Diphtheria, the non-bad version of it, should I say? It wasn't the really bad version of it. But so I went on something called azithromycin, and I had it for 10 days. Day 9, I was in a hole. I was literally on the sofa, depressed, almost like not suicidal, but a good way along. Like life was not good. And so I started researching it at the time, and there was a study of people on azithromycin. Actually, it kills off the specific type of bacteria that converts the precursor to 5-HTP, tryptophan. So converting tryptophan to 5-HTP. And obviously, as we know, 5-HTP is the precursor to serotonin. Yeah. So of course, people in this study, there's about 50 or 60% of people in the study that are using azithromycin for 3 days, not 10, came out depressed from use of it. It's interesting, isn't it? So what it can do to how we break down our food proteins down into aminos and then down into our neurotransmitters. It's insane, isn't it?
That doesn't surprise me at all because, again, what you're alluding to there is the impact and the association between the gut and brain and the gut-brain axis. There was a study done on, I think, around 14,500 nurses in the UK. And they looked specifically at the correlation between people who'd taken, at least 2 months worth of antibiotics. And they found that nurses who took at least 2 months worth of antibiotics in their lifetime or more had reduced working memory scores, learning capacity, memory, focus. So it shows how the negative impacts of antibiotics on gut bacteria and how that can play out beyond just the gut. Again, to your point, they're essential, but we need to limit their use to specific indications only.
Yeah, I mean, it's crazy stuff. I mean, crazy stuff, but amazing stuff at the same time. It's funny, isn't it? It's like a burger. Burgers are fantastic. They taste amazing. You just want to eat more, and yet they're so bad generally. It's like, I know it's a really bad comparison, but it's so true.
But also, actually, a lot of the time we can't control the antibiotics that we consume because even a lot of animal products, these animals are fed antibiotics in their feed. And so down the food chain, they work their way into our systems. And those feed antibiotics, which are given to animals, they still, interact with our body systems in the same way. So even if you don't take antibiotics, you might find some way into your food supply.
Yeah, especially around traditional dairy, because obviously they pump the cows full of hormones to make sure that they produce more milk and the hormones and then antibiotics as well. And it's like cocktail. This is why I actually get my milk from Hillside Farm, who have A2 cows, so A2 protein. Obviously, it says the A1, which is not the traditional, and it's raw as well, and it's farm to house. I get it shipped every week, but I found that actually helped my gut so much. I went from not being able to tolerate dairy at all, from having extreme danger from having dairy,
Yeah.
traditional dairy, to actually after using it only for 3 months, then found that I could tolerate normal dairy a little bit again.
So it's interesting about the dairy thing because even those people who are lactose intolerant can usually still tolerate around 10 grams of lactose a day.
Hmm.
Sort of in around, 10 grams of lactose in milk, it'd probably be around 150 mils of milk or something like that. And, in small servings of 50 mils a pop at each meal, they can probably still tolerate that. And there's some evidence that daily consumption of kefir, which is fermented dairy, fermented milk product, that can actually help to reverse some lactose intolerance symptoms because there's a process called colonic adaptation. Your microbiome can adapt to this lactose load in small amounts and sort of reverse some of those symptoms. So that's fascinating. I think.
Yeah, I mean, I love that milk for that. When I shed it out on Instagram, I got a little bit of pushback saying, "Oh, you can't drink raw dairy. You'll get food poisoning from it." And there's some really bad cases. Yeah, but actually, I think it's 19 times the amount of cases of food poisoning from chicken than there is from raw dairy. And you're like, "Oh, you can't be talking about this. This is bad." And it's like, yeah, but the amount of people that have messaged me that said, "I can't believe how this stuff works for fixing my gut." And not necessarily the A1, because obviously they've had a lifelong, supply of A1 dairy versus A2. So yeah, Hill Farm, big shout out to those guys. They're not, again, not a sponsor. Don't get anything for sharing. It's just like the stuff that I love. So yeah, so you mentioned fiber, which is actually a really fascinating topic because, there's two sides of the fence. Some people say you should have more. Some people say you don't need any. And, obviously the truth lies in between somewhere for you or anyone as an individual. And so what are the best forms of fiber for optimizing gut health? And how can listeners make sure that they're getting enough of the right kind each day?
Yeah, so rather than thinking about a specific kind of fiber, you just need diversity of fibers. That's the sort of final solution. So if someone, you often hear trotted out on social media this magic number of 30 grams of fiber a day. That's all well and good. And we'll come on to why that is simply just a number. Because if I said on the left-hand side here is someone who's eating 30 grams of fiber a day, but all of their fiber comes from broccoli. This person here is only eating 20 grams of fiber, but the 20 grams of fiber comes from 7 different types of foods and vegetables and whatnot. This is better, even though they're having less fiber than the 30-gram person, because the sources of phytonutrients and polyphenols and prebiotics are so varied and they have different roles. Because the prebiotic fibers in an apple, pectin fibers, they have a specific role to play and they can encourage the growth of specific types of bacteria. In a banana, you have fructooligosaccharides, FOS. Those prebiotic fibers can help to improve calcium and mineral absorption. The beta-glucan prebiotic fibers in oats, they have a role in satiety, but also cholesterol reduction. They bind to bile acids and cholesterol and can lower your cholesterol levels. So different prebiotics and fibers perform different roles. So we need to get out of the thinking of thinking fiber. We should be thinking of fibers, plural. Just like we don't say take your vitamin, we say take your vitamins, plural, because vitamin A performs a different role to vitamin D. Same thing, inulin performs a different role to pectin, to fructooligosaccharides, to galactooligosaccharides. These are all different prebiotic fibers. So the name of the game is diversity. And as I said earlier, my sort of go-to breakfast could be something like chia seeds, Greek yogurt, and raspberries. That has probably upwards of 15 grams of fiber and also has around 20 grams of protein, just that breakfast alone. And, chia seeds and raspberries, those two combined together, 15 grams of fiber, like that's pretty easy to get. And you're already halfway towards that 30-gram target as well.
I mean, I love chia seeds. I know, like, Paul Saladino or some of the other, more carnivore-esque peoples. And full disclosure, I'm trying carnivore right now, as you know, because I just had to fill it. But on its own, although I did cheat and have a bit of mashed potato today. But they do say, oh, you shouldn't do that because it just scratches the gut lining and it creates this gel around the seed to protect it and all this lot. But you know what? Whenever I have chia seed, and like, for instance, I travel quite a lot and I go to hotels and they often have like a chia pudding for breakfast with some raspberry jam or something or other. I love the chia pudding, and I'm like, my digestion loves it. Loves it. Like, not just likes it, loves it every time.
That little, gel on the outside of chia seeds, that is one of the benefits of the fiber. So that's called mucilage, and you get the same mucilage with flax seeds, aloe vera. You get it with psyllium husk as well, and you can get it with okra. Okra sometimes a bit slimy. It's that mucilage, and that mucilage is a polysaccharide. It can be broken down by your gut bacteria. And it's good. That kind of slime, that sort of plant slime, as it were, is the beneficial bit of the chia seeds.
Yeah, I love it. It's just something my body just goes, I want more of this every time, literally every time. So it tells me something for sure. So before we move on to a rapid fire, I just want to ask you a couple of questions beforehand, because I talk a lot about blue blocking glasses and I found them to be fantastic for me. But what's your take on them?
Again, this is something I've flipped and flopped on. And then I've spoken to an ophthalmologist who knows a lot of people who are involved in manufacturing these blue blocking glasses. Now, if you look at the data, there is data for and against blue blocking glasses. And some of the proponents against have claimed a lot of these studies have been industry funded by companies which manufacture blue blocking glasses. So there's some bias in these studies. But then if you speak to a lot of people who use them, they find some benefit with eye strain, better sleep, all these sort of things. And again, my personal opinion is if you just look at the data, maybe you won't find tons and tons of strong data to say that they are effective. However, as an intervention, if someone is using blue blocking glasses, is it doing any harm? And if they find some benefit with eye strain, it's helping them sleep better or relax at night, what's the problem? They're a pair of glasses. And if someone can afford them and use them, great. But I also think, just to add to that, if you're using blue blocking glasses and then still using your phone at night, there's no point. It's not a panacea. You still have to do the good things. So that's my sort of opinion on that.
Interesting. Yeah, I mean, it's funny because when I got into biohacking, I'd see the biohackers wearing their blue blocking glasses. And I think, let's be honest, some people just like to stand out. And in fact, I err on the side of caution with wearing them because I don't want people just to think I'm a diva wearing these orange or yellow glasses, I found for me personally, actually, the most interesting note for blue blockers specifically for me are that my resting heart rate drops around 12:30, 1 o'clock in the morning if I wear blue blockers for at least 2 hours before bed and don't use lights in the bathroom and I haven't got my phone in my face, for instance, which I, steer away from the majority of the time. If I don't wear blue blocking glasses, I can still fall asleep, okay. But I notice that my resting heart rate doesn't drop until 6:30.
And see, you're using data to justify and validate your experiences, which I love.
So it's an N equals 1. I mean, again, maybe anecdotal, but the thing is like I found them to be so specific. The other thing is that there's quite a few brands out there, and there's yellow lenses which help with eye strain and a little bit block about 40 to 50% of blue light, but not all of it. And then orange and red, and it's actually really interesting because some of the studies, and I've looked into this actually because obviously I want to know if it's super beneficial. Generally, the studies that have been done where they're non-efficient or non-effective have been with the clearer lenses you can still see the color blue through. But when it's the orange, not the yellow, the orange, and you can't see blue through them, you use a light spectrometer, that's what the studies that are efficient, effective on have been used with. So it's down to the color of the lens. But obviously, the darker the lens, the more of a diva you look. So it's a necessary evil. So one final question before the quick fire. I want to ask you your opinion on hydrogen water, because I had heard, and I'm typing into my ChatGPT from a conversation I had with it a few weeks ago about how hydrogen is very good, obviously, for ATP production and whatnot. But I did hear that it was good for gut bacteria potentially as well. Are you familiar with anything to do with this?
To be honest, I'll have to put my hands up and say I don't know enough of the science about what hydrogen water claims to do as a benefits. My initial thinking, if someone just mentioned hydrogen water to me, would be thinking, it sounds like a solution for a problem that doesn't exist, right? Because for me, my favorite liquid is water. You know, I don't drink alcohol, and I haven't done for years. And I always love a cold glass of water. That is kind of my favorite drink ever. Boring, but I don't know. Like hydrogen water, it seems like you're biohacking water. That's my sort of personal feeling. But I'm also open to seeing data that says it's better for XYZ reason. But I don't know if I would shell out extra cost for something like that when I can make sure I've just got filtered water at home and it's, I can make sure it's, clean, safe to drink, whatever. That's my gut reaction to it.
No, gut reaction. I like it.
Yeah.
Smart. Okay. So yeah, I mean, I can't find the specific gut bacteria thing at the moment, but actually I saw Gary Brecker on stage in Dallas a few months ago with a ORP meter, so looking at redox potential of water. And he had a glass of bottled water straight out of the bottle, measured it, and it had a positive of around 320. And he said, look, this is how pro-oxidant the water is, because, it's been in a plastic bottle. It's not come through streams, down through mineral and magnesium-rich rocks and stuff. So therefore, it's a positive, it's inflammatory. And then he dropped in one of his H2 tabs. So it's him and his son's new hydrogen tablets. And again, I'm not sponsors, by the way. They're not sponsors or anything like that. Just fascinating to see it in like live demo. Dropped in the tablet and then put the meter back in after a minute or two, and it showed it was a negative 300. So redox potential was fantastic, showing that it's obviously more of an antioxidant versus a pro-oxidant. So I was like, I love tracking things like my sleep and my heart rate variability, and it really does tell us a lot. It's like, I'm going to read into this. So I really spent a lot of time trying to understand this whole hydrogen thing. And this is why I carry a bottle around with me everywhere and carry the tablets around when I don't want to carry the bottle. It donates an electron to electron transport chain. So it helps our mitochondria, which means that we have more ATP, outputs of better energy, which is great. I was like, but where does hydrogen water come from in nature? Well, actually, it's more hydrogen rich in nature, but now it's hydrogen deficient or less so because it's not got magnesium and the other elements that help it become more hydrogen rich. It's super, super interesting. But I did read it and I was hoping that you would know the area about it, but apparently it really helps with gut bacteria as well, helps gut bacteria flourish. So I'm going to have to dig into this and we'll chat about it another time.
Yeah, I would love to know about the effects of that H2 on gut bacteria. But yeah, I mean, I would need a lot of convincing to go down the hydrogen water route, because I don't know, for me, I'm always looking for like easy wins, right?
Yeah.
And for me, water just seems like sacred ground. It's like, leave my water alone. What's the next thing? I don't want to be sold something that I don't need. That's my.
Yeah, no, I get it. And to be honest, I wanted to, when you said that, I wanted to have a little stab to test you a bit because I know you are very very proper when it comes to the science and quantification of the things that you talk about, and I really do value this very much. Which is one of the reasons I wanted you on today is also because I just love your content and I love the way that you deliver it, and it's done very well. So. Right. Okay. So rapid fire before we wrap up today. And I feel like we could go on forever, to be quite honest. It's great. So what's one popular health trend you believe is most harmful?
Most harmful? There was this popular trend a while back. I don't know if it's still popular now, where people were just dry scooping creatine and other powders. It just seems bizarre. And I think that's pretty harmful as a trend. Yeah.
Try scooping.
Yeah.
Yummy. Okay, yeah. Okay, this is a good one. I mean, I once took about 50 capsules of San Pedro on a retreat that I did somewhere or other. The thing is, I didn't think about its powder, and that powder needs to absorb stuff. And so I
Yep.
ended up with a migraine, nearly passing out because my blood pressure dropped so much. I had to
Yep.
get, trace minerals into me pretty quickly. So yeah, I mean, taking powder dry, I mean, the water needs to go somewhere. And where's that water generally? It's in the gut, right? So what small daily changes have the biggest payoff for long-term gut health?
Yeah, I mean, I'm very biased on this, and I think it's fiber. There was a meta-analysis done in the British Medical Journal several years ago, which suggested increasing your fiber intake by 10 grams a day lowers your bowel cancer risk by 10%. And there's been, further meta-analyses and systematic reviews since, which have showed similar, small tweaks for big outputs in cardiovascular disease risk, all-cause mortality. So, even a small amount of fiber increase per day, huge payoff.
Good for cholesterol levels as well, right?
Yeah.
If you ran the NHS for a day, where would you start to fix and support the NHS where it'd have the most impact?
So first of all, I would beg someone not to give me the keys to the NHS because I have no desire for that ever. You couldn't pay me to run the NHS. If I had to, sort of gun to my head, you have to do it for a day. I would, I need to know more about the financial structure because, I'm on the outside. Even though I've been in the system, I'm on the outside. I don't have the intricacies of the budget, but I would like to look at the budget and look at the budget allocation because the NHS is fantastic for urgent care. If you break your leg, go in, get some of the best surgeons in the world fixing your leg, sorting you out. If you have a bowel cancer, you go in, get your bowel cancer removed, and then maybe a week later you're discharged. Fantastic for that sort of immediate service. The flaws in the system come when it comes to chronic problems like mental health and chronic gut health. I want to see more funding towards things like that, women's health, gut health, and mental health specifically, and what's being done there budget allocation wise. So that's where I'd dig into.
Amazing. I mean, if I were to, and I'm going to ask myself this question just quickly, I would get the NHS to employ the best functional medicine doctors from around the world or integrative medicine doctors from around the world. Because if I would go to a doctor and I had sleeping problems, they would say, here's some sleeping tablets.
True.
And then they get hooked on sleeping tablets and don't fix their lifestyle issues. Whereas a functional medicine doctor would say, okay, blue light, or are you winding down, or are you watching Netflix and watching, something with killing on it or whatever. So I think, if we got people in the preventative or the lifestyle stuff, I think that would filter down into the NHS quite quickly and we wouldn't prescribe so much stuff and doctors wouldn't be so stressed. So
Tying different body systems together.
yeah, I mean, again, like I mentioned during lunch, I do think there's a place for both medical and, more, not holistic, I don't like this word, but, more,
360 care.
Natural. Yeah, because if the medicine system wasn't broken or if it was working, we wouldn't need something else. And if nature was working, we wouldn't need medical. So, okay. What's the one biggest quick win the NHS could do to save millions of pounds? Gut feeling.
Ooh. To save millions of pounds, actually look at what tests you're ordering for patients. In my experience in the NHS, it's actually pretty shocking. So sometimes when you're doing blood tests on a patient who comes into hospital, it's an online system where you can order the blood test the patient needs. And a patient comes in with, for example, they've been constipated for 5 days. The blood tests you do, or they've got pain or something like that, you need to justify why you're doing each blood test. Now tell me, why are you doing those liver function tests? What are you trying to exclude? If you're just doing them in the hope that they throw up something positive, that's not a good use of that test. Every test that you click on the online kind of shopping basket when you're ordering the test, that has a price tag. And in some trusts, it actually shows you the price of those drugs, the price of those blood tests. Like an amylase to check, for pancreatitis or something, could cost £12, £20. I don't know specifically what it is. Does that patient need an amylase? You should only really be ordering an amylase in specific cases. Do they have pancreatitis? Are you worried about a pancreatic cancer? Otherwise, why are you doing a routine amylase? That's an expensive test. So if someone is getting an amylase as a routine test, and you multiply that by the number of patients in the hospital per day, per week, per month, times hundreds of NHS trusts, that's your millions right there. So rationalization of blood tests.
Awesome. I hope people are listening to this. So,
in fact, I just to add, I did an audit several years ago on unnecessary use of repeat amylase testing in patients with pancreatitis. So when someone comes in with suspected pancreatitis, inflammation of their pancreas, you do an amylase to see if that's one of the criteria that they could meet. Once a patient has had an initial amylase done and they've been proven to have pancreatitis, you don't need to monitor their amylase levels. That doesn't correlate with if they're improving or not. And I actually showed in one trust, and I won't name the trust that I was working in several years ago, if you stop the repeat amylase testing for all pancreatitis patients, you'd save over 6 figures per year just for that one test.
Compound effect. And you think about across the whole NHS and all of the
hundreds of thousands in one trust for one unnecessary test.
Thank you very much for coming in today. It has been really good to spend some time with you and chat and challenge you a little bit on some of the things and hear what's what. So it's really great that you come in today. A huge thanks to Dr. Karan. I really, really appreciate you coming in today. You've got to follow him. Like, I love watching his content. You can dig deeper and start making informed choices today because the NHS isn't changing anytime soon, and you can take charge of your own health. Thanks again.
Thank you very much, Tim.
You've been listening to the Health Optimization Podcast, and I'm Tim Gray. If you've enjoyed this episode, give it a thumbs up, leave a comment, and subscribe for more. Remember, if you want to learn how to take control of your health and you're sick of traditional healthcare and temporary fixes, you should come to the Health Optimization Summit. It's going to be even bigger and better than ever and packed with game-changing info. We've got over 35 industry legends joining us, including Barbara O'Neill, Dr. Josh Axe, Dr. Von der Wright, Gary Brecker, and so many more. It's a weekend you will not forget. Grab your ticket now at hosummit.com/UK. See you next time, and remember, let's spread the health.